Hello. As you all probably know, I'm a neurosurgeon and a spine surgeon by profession. And although I'm responsible for a lot of what goes on in the department that I work in, I don't do it all alone. I have a huge team and a whole bunch of dedicated, hardworking people who support me in every single facet of my work. And today, it's my great pleasure to introduce you to all of them. So first, I'd like to introduce the man who makes surgery possible in our department. And that is Dr. Kiran Prasad, who is the consultant neuroanesthesiologist in our team. And the reason why he makes surgery possible is it's impossible for us to do anything on a patient in the operation theater without great anesthesia. The reason is that, as you all know, the brain and the spine are very delicate and important organs, and the patient needs to be extremely comfortable and still during surgery.
I'm Dr. Kiran Prasad. I'm a consultant neuroanesthesiologist. My interest in brain and spine surgery has been from the last 30 years, and this is what I have been doing regularly. I have been with Arvind for the last 20 years, and I love this team, working with him and with the rest of the team.
So next up, another very vital member of the team is Dr. Usman, who's a consultant neurosurgeon. He's a vital member of the team because he fills in for all my deficiencies. So he's another set of eyes and ears in the team, and things that sometimes I miss because I'm preoccupied and looking after patients, looking after OPD on a day-to-day basis, reminding me about certain important facets of managing patients in the outpatient and in the operating theater are all his responsibility, and he does a great job at that.
Hello, my name is Dr. Usman here. I'm a consultant neurosurgeon. Being with part of this team and with Sir for a long time, it's great pleasure to be in the team and doing a good thing over here.
Thanks, Usman. Thank you. So just like I have my eyes and ears in the form of Dr. Usman, an extra set of eyes and ears, Dr. Kiran Prasad, our neuroanesthesiologist, also has a need for an extra set of eyes and ears. But he has the good fortune of having two sets of extra eyes and ears, and they are Mr. Pandiyan and Lavanya, who are the neuroanesthesia technicians in our team. In addition, Mr. Pandiyan is also the coordinator of the neurosurgery department, and apart from taking care of preparing the patients for anesthesia and making sure everything goes well during anesthesia, he also does additional work in the form of managing the department, coordinating various facets of the administrative part of our department. So over to you, Pandiyan and Lavanya.
Hi everyone, this is Pandiyan. I'm the senior neuro anesthesia technician here, and I'm a neurosurgery coordinator also.
Hi, I am Lavanya, anesthesia technician. I'm very happy to this our team.
So when we are doing surgery, we have a lot of people inside the operating room who are involved with assisting various parts of the surgery. One of the key people in that atmosphere is the scrub nurse. The scrub nurse is responsible for making sure that all the instruments that are required during surgery are ready. He or she is also required to hand out various instruments to the surgeon while the surgery is going on, and also keeping very cool when the surgeon is losing his. So our chief scrub nurse is Mrs. Velangini, who's been with us for about 10 years now. She's very modest, extremely hardworking. She can stand during surgery for hours and hours without complaining. And I'd like her to say a few words.
ನನ್ನ ಹೆಸರು ವೇಲಾಂಗನಿ. ನಾನು ಸ್ಕ್ರಬ್ ನರ್ಸ್ ಆಗಿದ್ದೀನಿ. ಅರವಿಂದ್ ಸರ್ ಜೊತೆ 10 years ವರ್ಕ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ಅಷ್ಟೇ.
She's very understated, very modest, but she's exceedingly good at what she does. Apart from the scrub nurse being an integral part of the team, we also have a lot of equipment in the OT that needs to be managed at the right time and in the right way, not only during the surgery, but also in between surgeries. So we have equipment. You can see something behind me, which is a very important part of our surgical armamentarium. In addition to that, we have many other forms of equipment that are used during brain and spine surgery. Some of it you may see a little later on this channel. But for now, I will just name a few things like the intraoperative X-ray, the intraoperative CT scan, our operating microscope, drills, and endoscopes, and a whole bunch of other things. So the person who needs to manage all this is also a very integral part of the team, because they really need to understand at a given time during the surgery what is going to be required and how to operate that equipment in the right way so that surgery can proceed smoothly. So the person in our team who is responsible for that is Mr. Hemanth Kumar. So he's been with us for almost 15 years. He's been able to expand his skills over that time as we've expanded our surgical armamentarium and equipment. And he's also, incidentally, a guy who cycles to work like I do.
ನನ್ನ ಹೆಸರು ಹೇಮಂತ್ ಕುಮಾರ್ ಅಂತ. ನಾನು ಹಾಲ್ ಎಕ್ವಿಪ್ಮೆಂಟ್ಸ್ ಎಲ್ಲ ಆಪ್ರೇಟ್ ಮಾಡ್ತೀನಿ. ನಾನು ನೀರೋ ಟೀಮಲ್ಲಿ ವರ್ಕ್ ಮಾಡೋಕ್ಕೆ ನಾನು ತುಂಬ ಲಕ್ಕಿಯಾಗಿ ಇಷ್ಟಪಡ್ಕೊತೀನಿ. ಅರವಿಂದ್ ಸರ್ ಜೊತೆ, ಡಾಕ್ಟರ್ ಕಿರಣ್ ಸರ್ ಜೊತೆ ನಾನು ಅದೃಷ್ಟ ಮಾಡಿದ್ದೀನಿ ಅಂದ್ಕೊತೀನಿ. ಐ ಥಿಂಕ್ ನಾನು ತುಂಬ ಸಂತೋಷ ಆಗ್ತಾಯಿದೆ ಜೊತೆ ಎಲ್ಲ ಇದ್ದದಕ್ಕೆ. ಥ್ಯಾಂಕ್ ಯು.
Thank you. So while Dr. Usman and I are busy operating in the operating room for sometimes several hours on end, we still have to look after the patients who are in the hospital and who are coming to our outpatient department. And a key member of that team that looks after patients in the ward, looks after admissions, discharges, patients in the outpatient, is Dr. Aiyesha Gulfam. So with her pleasing personality, she's able to make patients wait sometimes endlessly for us to see them in the OPD. And she also fulfills many other roles, looking after patients in the ward and in the outpatient, assessing them, doing the primary assessment, getting investigations done, getting discharges done, and a whole bunch of other things.
Okay, so I've been with this team since past 5 years, and every day there's a new thing that I learn, and I'm very thankful to Dr. Arvind Mateja and the team for this opportunity, and here's to many more.
So I really hope you liked visiting my channel on YouTube and you liked the videos I've posted. It'll be a great help if you can subscribe to my channel and click the bell icon for notifications on YouTube. That will go a long way in supporting our work and the channel here. Thank you.